finances shouldn't be the goal of a healthcare organization. Do we have to balance the books? Of course. Do we have to save for the future? Sure. But that's a tool. It's a tool to serve the mission. It's not the goal.
So, Dr. Jeff Thompson, you are a pediatrician who has served as the CEO of Gunderson Health Care for 14 years, I believe, and you had under you 7,000 employees, and you garnered national honors for patient care, and you are also the author of Lead True, Live Your Values, Build Your People, Inspire Your Community. Welcome to PedChat.
Thanks for having me, Zach. It's good.
So I gotta say, Jeff, that after reading some of your articles and excerpts from your book, leading up to this call, you're a little like the doctor from the new hit TV show New Amsterdam, Dr. Max Goodwin. And as he's the executive pushing people and healthcare over profits, at this fictional character in New Amsterdam Hospital. You're kind of similar, and as you put it, you made a decision to compete not for size and profit, but for the long-term and well-being of the community.
Right.
How did this, strategic direction impact Gunderson and the community it serves?
One of the keys when you take on leadership roles, and I think pediatricians are great stock for leadership roles. They have a breadth of understanding of patients and families. They understand how to work in broad teams. There's a lot of women in pediatrics, and we certainly need more women in the ranks of rising leaders that will help us. So I think pediatricians are set up, and a lot of how I went about doing this has its underpinnings in how we're trained as pediatricians and the priorities that come out of the people that you train with. One of the most important pieces was, as we set up our goals and our plans for the organization, who did we focus on most? If you look at an organization, you're applying for a job or you're saying, how's my organization doing? Look at their goals. And what are their goals? Are their goals self-facing and self-serving? Is it, well, we want to get our margins from 3.1% to 3.2%? That's inspiring. Or do we want to crush the competition? Yeah, well, fine. I mean, it's nice to use sports analogies when you're talking about people's lives, but if you turn it outward facing and say, join this organization and we're going to improve the health and well-being of patients in the communities. That doesn't say anything about you or us, but it will attract people and it will inspire people who are really wired to move in that direction. There's a lot of pediatricians that are wired just like that. So it was an easy step for me to say, here's where we're going to go. Here's what we're going to do. We're going to declare that we're outward facing. We're going to improve the health and well-being of patients in the communities. We're going to improve quality and involve patients and families in that, improve service, take care of people as if all were loved ones. We're going to have a great place to work, not an easy place to work. It's a hard place to work. Don't come here if you think you're going to coast. We're going to have a high set of values. We're going to have high standards. We're going to aim to be as good as anybody in the country. That's a hard place to work, but it's a great place to work because when you get done, you say, man, I worked with amazing people who cared about the breadth of the community and we accomplished something.
And this strategic alignment, I think it went through the whole organization. In fact, you said something in one of your talks that to build a great organization, you can't allow a privileged few to behave inconsistently. And in fact, I read that you have all new employees sign this like one sheet contract that states your values and that mission you just alluded to, and they have to sign it or else they can't be a part of the company. What made you think of that concept, having them sign this contract, and how did that affect the organization?
So you're right, and I'll answer that question. I'll just correct one little thing. Even more powerful than having people sign a contract is having them agree to a compact. And we didn't have them sign the contract. We didn't have contracts. We have this compact, and we said, here's how we're all going to live. And if you apply for a job, you said, look at this first. And if you can live with this, this is going to, here's what we'll promise you as an organization. And then here's what you'll deliver as a member of this organization. And we started with the medical staff, went to the administrative staff. Now everybody in the organization has it. And it's a way to say, we are going to work as a team to take care of each other so that we all can take care of someone else. But we felt we needed to be explicit for a couple reasons. One, some people need a little more detail on understanding what the values and the mission are. But also we want to give you the best chance to succeed. If you can't live by this, then you don't apply. Don't bring your family. Don't bring your spouse. Don't come here if you don't think you can treat everyone with respect. If you believe doctors ought to be treated one way and everybody else, because they're not quite as smart as us, treated something different, this is not the place for you. You'll not succeed.
Yeah, I love the values approach. At our company, Go Check Kids, we've been defining our principles, which is our version of values. It's just a different word we use. And I found myself more recently, as we've drilled down into our principles, making decisions based off of them. If I have a hard decision and I'm unsure about it, I go to our 5 main principles and everything that's underneath those principles. And I say, I'm going to make this decision because it's most in line with our principles. It actually makes decision-making easier, which is interesting.
Actually, I think it improves innovation as well. People say, well, innovation, what about smartphones? Wasn't that, 7 guys in some basement juggling Nerf balls and they came up with it? No. Thousands of team members, engineers, social scientists, many different people from different backgrounds, making a plan, testing the plan, failing, trying again, innovating, but they knew where they wanted to go. They wanted to keep making a product more and more facile, more and more able to be adapted to different environments. If you want to innovate in your organization, you give them structure, where you're going, the values. You make you make it available to connect with other people from other parts who have different thoughts and ideas. You get close enough to the work so you really understand what's going on. That's the senior people rounding so that they can encourage people. And the final piece I would argue would be a disciplined disregard for conventional wisdom. Now, whatever your grandmother told you, that's probably all right. The rest you have to be skeptical about. Just because you're an old guy with a bunch of degrees doesn't mean you know what you're talking about. You have to have a disciplined disregard. Some of the ancient wisdom is great and should be gone, but others, well, let's go back to our environmental program. There is a mindset out there that it's either the environment, taking care of the environment, or taking care of your bottom line, or taking care of the environment and the local economy. We just went to our board and said, here's the deal. We want to improve the health of the community and lower the cost of care and improve the local economy. If we do all 3 of those things, are you with us? They said, of course. They'd be crazy not to do that. So that's exactly what we're going to do. They said, but doesn't it cost money to do this? I said, absolutely not. We're going to do it so we make money. So conservation, you make money hand over fist doing conservation. You get very rapid paybacks. And we developed a program that investing in it made more money than stocks and bonds. Investing in it had a very rapid rate of return, and it improved the local economy, and it decreased our burden, our environmental burden on our whole region. So conventional wisdom needs to be questioned. Sometimes it's fine, and sometimes it's not so good. So a little structure can sometimes improve innovation. You give them structure and then let them run. They'll know where the fences are, but then you let them run, and then they can innovate and create all these other things.
I want to dive into this energy thing, which you've kind of talked about briefly as a part of some of these answers. And it's a big, you're very fiery and passionate about this. And it's a way that you united the community around Gunderson, as it relates to producing. I think it was something like Gunderson was the first hospital system in the US to produce more energy than it consumed back in 2014.
Right.
What led you to start this initiative, and what does it mean for the community around Gunderson?
So the environmental activity at Gunderson started primordially in the 2003s and 4s and 5s and that, but by 2008, we had formed a group and said, if the principles of our organization is to improve the health and well-being of the community, that's our purpose. That's one of our founding, our focusing principles, improve the health and well-being of patients in the community. Then our making the environment worse for them to live in is not consistent with that. And we have to be more disciplined and examine ourselves. So this is straight out of Jim Collins' Face the Brutal Facts. And the brutal facts were we're putting all this pollutant into the atmosphere. We're throwing things down the drain like the government said we're supposed to. We're sending things off to incinerators. All these things were going on. And we said, that's really not okay. It's not okay because we're pediatricians. We got rid of mercury long ago, but we also know mercury is a terrible neurotoxin. Well, Gunderson is this health system trying to take care of children, pediatric neurologists and neonatologists, all the great pediatricians we had. At the same time, when we turn on the light switch, coal was being burned to generate that electricity, and in that coal is mercury that would come out into the smokestacks, spread across the land and the water, the food that was then being taken in by our patients. Said that's not okay. We led with improve the health of our communities, save money, and improve the local economy. So we weren't just passionate, we were strategic about how we rolled it out, which is an important lesson for young leaders coming out. Even if you're wildly passionate about a very appropriate cause, you have to still pay attention to your audience and see what's going to do that. And then we said, how would we go about lessening that? So we'd look at our waste stream, and so a group worked on waste stream and dropped our hazardous pharmaceutical waste by 2,000% by just basic management improvement techniques. We started doing conservation, so I spent $2 million on conservation projects across this big organization and saved $1.2 million every year thereafter. So even if you have a very skeptical board or a financial officer, you go to them and say, okay, so what other investment do you have that's making over 60% every year, guaranteed? Now, you can't be a one-trick pony. You have to, if we did that and then all our patients were dying in the hospital from bad care, that'd be a bad thing. So we had to show that we could do both of those things and lead the country in advanced directives for our seniors. So it wasn't just about the environment, it was about our seniors and about taking good care of patients and lowering the cost of care and developing a breast center that had the best outcomes in the country as judged by the breast centers. So we built multiple channels, but all on the single philosophy to deliver on our purpose to improve the health and well-being to patients in the community. So it all filtered back to that. I didn't have to tell all these people what to do. They knew. They lived by these values. They aimed to accomplish improving the well-being, which included the financial well-being of the community, not just their health, but name me a community that has terrible finances that has great health. It's tough to have health if you're not financially healthy. So we said we have to do them all. That's our job, but that's the difference between coasting into mediocrity and trying to be great.